I am so proud to see so many people here. I am really, really pleased that you saw this come through your email box and you thought, I must be there. So I'm really grateful to you, especially on a Monday morning with the roads as they are, the parking swallowing our money, the coffee not arriving on time. I'm really pleased to see you all here. And as Michael said, this is such an important day. I think it's really important because actually Panorama are doing their stuff again tonight, aren't they, on the Jimmy Savile situation and looking at what the BBC did or didn't do or who knew stuff and who didn't. And I think that's one of the real challenges for us as public sector, voluntary sector carers, private sector providers, is actually constantly, as Michael says, challenging ourselves about if we don't know what we think we're supposed to be doing, asking, but if we're seeing something that we don't like, making sure we talk to someone. And it's the job of the top of the organisations to make sure that when people speak, they're heard, they're believed, and action is taken. Because I don't know about you, but I think it's coming up again that actually when people talk about things that they've seen that have happened or happened to them, people still don't want to hear it and they don't want to expose stuff. So that's why today is just so important to us, because it's a constant reminder that actually we all have to be brave, and we have to be brave whether something's happening to us, whether we're seeing something, or whether we've got to take a decision to take some action that others might find uncomfortable. I think one of the things that we need to look at in Surrey is the fact that we do have a very large population of people with a learning disability, and isn't that great, because that enriches our community way beyond other communities. And I've been out recently seeing people who've moved out of the long stay hospitals into independent living, and they're having a completely different life. I've seen people who've moved from living with their parents to now living independently, and they're really enjoying it, and their parents and their carers are really enjoying seeing them independent and happy. And I've seen lots of people having a really different experience. And one of the things that we've got to do is make sure that we hold on to that vision of what we want to achieve, that valuing people set out to do, and that we make sure that actually people do have the same life experience as others, and they have every opportunity that they need to have. We've had some situations recently in Surrey where we've had to be very brave. I had to be very brave last Friday. I spent the whole night worrying about it. I had to go in and have a really difficult conversation with some people. And things have moved on, and we're getting there with a solution. And it is about every time you want to take that backward step and think, oh, this is too hard, actually remember that we're there for people who can't articulate for themselves or maybe can't represent themselves, and we need all to be brave in doing what we're doing. So I'm just going to do a quick whiz through, because I'm conscious that we've got a lot of fantastic speakers who are really steeped in the experience of this. But I just wanted to remind us, first of all, of why we are here. And because I am completely technically incompetent, Liz is going to help me with this. So we want to talk about the fact that we've been here before. And I think, you know, I've been 30 years in local government, social services, health, child protection, adult protection, and we are still learning the lessons from all of these serious case reviews. And I don't know about you, but my heart absolutely sinks when I hear it's about a communication, it's about us talking to each other, it's about us doing what we should have done. As Michael says, the manuals, the asking of the questions. So we've had lots of inquiries before, and now we've got Winterbourne View. And I think that we're looking at things that span a long period of time, and it is about us making sure that we really do learn the lessons this time. Just keep going and come up. I think one of the things that I think has shocked other people a bit is that actually it was in what people would see as a hospital setting. And I don't think that we want to get into the debate around settings at the moment, but actually it is important that when we're looking at this, we really focus on the role of commissioners in making sure that services are fit for purpose in Surrey. And I think with the changes to CQC and the broader brief that they now have, the emphasis has got to be really strong on those of us in local government and in CCGs and in the National Commissioning Board to make sure that we're commissioning services that are fit for purpose. So Winterbourne was a private hospital for adults with a learning disability, you know this, and an undercover reporter went in and filmed. Now, I don't like that. I don't like programmes that go in and film without telling you, because actually I think that puts the staff in a really difficult position. It's really uncomfortable. It's not a practice I like. But when something like this happens, you have to sort of say, well, actually, do we need it to be like this still in order to find out what's going on? We're just going to play a little bit of the whistleblowers' report.
It was like a perfect storm. It wasn't just one thing. The commissioners were happy to send someone to a place like that. The management was inept. The training was substandard. They recruited strong-arm people, not caring people. The staff weren't paid enough. There was no supervision. When the safeguarding team was alerted, well, they didn't act. When I alerted CQC, they didn't act. What else do you do?
And I think that's the bit that was so powerful, that actually people weren't acting on what they heard. They weren't listening to people, they weren't believing people, and they weren't doing what they needed to do. I'm sure we've all experienced that in this room and have felt completely impotent about it and difficult about the fact that we will have seen something, we will have said something, and either we didn't act or we did act and nobody did anything. And I think part of the solution to making sure that this doesn't happen in Surrey is about us getting in touch with those feelings and that sense of responsibility that we have as professionals, carers, workers, relatives working with people or experiencing our life with people with a learning disability and other care groups, that we do take this the action that we need to. It isn't new. When I started out as an unqualified nurse in Severals Hospital in Colchester, if any of you hail from that area, worked on a ward, not in a private hospital, but a similar setting, saw a nurse hit a patient and reported it, got moved, reported it again, got moved, and eventually left and reported it separately. But it is that sense that I knew that that person was still there and being cared for, and it is that bit about constantly needing to go back and make sure that if we do see things that we make a noise about it. So eventually 11 members of staff pleaded guilty. One of the things that came out of the dignity work recently was how we recruit staff into our business. And there's a line that I really like: recruit people on their values, you can teach them the job if the values they hold are sound. And I think that's one of the things that we need to be absolutely clear that we do. It's really easy in this time of pressure when you can't fill vacancies or when you've got people who are off sick with stress and you're trying to cover with whatever way you can, that actually we make sure that the people who are doing this work actually want to be doing it, they want to enjoy doing it, and they have that compassion and that vocation and that drive to provide the best care possible.